Today, we are talking about the hurdles that healthcare professionals have to jump over when navigating health insurance. While this episode is geared more towards doctors, nurses, and medical staff, if you're a patient, don't turn it off just yet. Stick around because you're going to get a behind the scenes look at what your healthcare team is doing to get you the treatment you need. I was personally amazed at how much more is happening beyond that 10-minute appointment you have with your doctor, from really comprehensive note taking to even calling your insurance company on your behalf. So, whether you're a seasoned physician, curious patient, early in your career, or nurse, this episode offers valuable tips on better understanding and managing the complexities of health insurance. This episode was made in partnership with the Allergy and Asthma Network and is a collaboration with the National Association of Medication Access and Patient Advocacy, also known as NAMAPA. We thank Amgen for sponsoring this episode. You're listening to The Itch, a podcast exploring all things allergy, asthma, and immunology. We are embarking on insurance. Today we are talking to Elizabeth Johnson from the National Association for Medication Access and Patient Advocacy, also known as NAMAPA, and she's going to talk to us a little bit about insurance from the side of the provider. And what does provider mean, in case you're just like me and had no idea when we first started talking about insurance? It basically means your doctor. So we're going to be talking about that. But first, let's learn a little bit about our guest, Elizabeth. Elizabeth, welcome. Can you tell us a little bit about yourself and about the organization NAMAPA?
Yeah, absolutely. Thank you for having me. I'm Elizabeth, and I'm a nurse by training. So I've been in primarily the allergy and immunology space for about 15 years. I've dabbled in rheumatology, infectious disease, as well as oncology. Basically anything that has a medicine that's hard to get is kind of where I've weaseled my way into. And I really just absolutely fell in love with specialty medications because they are hard to get. And I like puzzles and trying to figure things out. And I might have a problem with authority, so I don't take no well for an answer. So that's really what has guided me into kind of this realm of insurance. And now I am the CEO of Medico CX, as well as a co-founder of NAMAPA. So I get to practice what I preach every single day. It really helps kind of having this C-suite title as well. So that's opened new doors and given me an ability to get behind the scenes of a lot of this. I still try to get in with patient care whenever I can. I really, really love the field of allergy.
Great. We're so excited to have you here, and I'm so excited to learn from you and all of your experience. So let's get right into it. So we're kind of looking at this more on the healthcare provider lens as opposed to the patient lens as much today. And so what do you think are the most common insurance-related challenges that healthcare providers face when trying to secure medications for our patients? I feel like I could answer this question, but I want you to tell us what are the hurdles that you experience most with all of your doctors.
So I think we can talk about it from an interesting perspective, because from my side of it, as I'm going to go from the nurse, right? I'm sitting there, you're in the room with a patient, and I see what's going on. You've got 4 more patients waiting to be seen. There's messages, there's refills to have happen. There's so many things moving at one time. And you as the provider are trying to be as thorough, document everything, make sure it's all there so that I can do my side of the equation, which is the prior authorization, submitting clinical notes, whatever that may be. But it's hard. There are so many moving parts and so many things happening. So when I think about it from the provider perspective, if you miss one thing in your note, because I can't say something happened if it's not in there, then I'm getting a denial, then I'm having you write a letter, or I'm setting you up for a peer-to-peer. So it's all these downstream effects from that one moment when you're just trying to finish that note. There's a lot of communication between the staff and the provider, and it's truly supporting that provider to make sure that they can get everything in there. Because again, if it's not in the note, I can't fight the insurance with it. And as a nurse, a lot of times, if we get a denial or something happens, I can take that and I can do a nurse peer-to-peer. But again, it all comes back to what's in your note, what you've talked to that patient about. And it gets really tricky sometimes. A lot of our medicines and allergy are over the counter now. So how do you appropriately track how many times they took Zyrtec or Allegra or Benadryl? So there's a lot there. So from your side, I understand it's I need to do my part, get a good documented medication history so you can have those communications with the patient.
Dr. G, is that the answer you would give?
Yes, that's basically it in a nutshell. We are just juggling so many different things all at once, and we're trying to make the patient feel heard. We're trying to make sure that we're being supportive. But at the same time, we also need to gather all of this information during that visit and make sure then we're documenting it. So, yeah, there are just a lot of things that we're simultaneously think about. And again, I've said this numerous times, but I don't think that it makes sense that doctors and doctors' offices now are also in charge of figuring out how to get the medication in the patient's hand. And so that to me is a part of the broken system and the part of the reason that a lot of doctors are choosing not to go into clinical medicine. That's not something we can change. And so that's why organizations like NAMAPA exist to help providers and to help make the process easier.
So I was going to add on to that for you real quick. So one of the other things is you're a physician, you have years and years of training and experience, but you're going up against an insurance policy. The insurance company's written the exact things they're looking for. And if they don't find it verbatim in your information, they're saying they can't have this. And so, we try to make all these quick fixes. We put quick templates in, we have the little shorthand keys that come up. We try to make it as user-friendly for you as the physician. But again, that's a lot for you to remember when you're trying to be patient-focused. It's always interesting to me that you get to be a doctor, but you get to play doctor against the insurance policy.
Yeah, absolutely. And I think that's just kind of the message too, because the provider-patient relationship is so important. I think oftentimes these prior authorizations and getting the medication into the hands of the patient can actually deteriorate the relationship that physicians have with their patients, unfortunately. And it makes it seem like we don't care, but really we do care. It's just that we're fighting against this uphill battle sometimes where we have given that information maybe 3 to 4 times in different ways over the phone, over a fax, through the EMR system. We've literally tried to send that information to the insurance company in so many different ways. But because it's such a complicated system, the patient still sometimes gets the message that your doctor didn't do what they were supposed to do. And then we're getting the message back from the patient, hey, you didn't do what you said you were going to do. And it makes us look disorganized and it makes the patient frustrated. And so that's also one of the messages that we're putting forth, just so that patients realize that you really do have to have, I think Dr. Anderson said it the best, where you have to give the doctor's office some grace and some patience, because this process is very overwhelming for everybody, including the doctor's office and totally including the patient, because they're the ones that are sick and waiting for this medication. So a day to them probably feels like a year, because they've been told by the doctor that this medication is what's going to make them feel better. And so they literally want that medication yesterday, and now they're having to wait. So we totally get it, but it's just one of these uphill battles.
And it takes one bad Google review for it to impact your practice. And so a lot of times in the world of social media that we live in, not only are we trying to be good healthcare providers, but it takes that one patient getting on there and saying, oh, they dropped the ball, I didn't get my medicine. Somebody else reads that, right? So you get a little bit of misinformation spread through social media and through things like that, when, again, we're kind of handicapped by what that insurance does. And so with NAMAPA, our goal was, the process is the process. Insurance is insurance. So it doesn't matter if you're in allergy and immunology, if you're in oncology, if you're in derm, there is a process to get these things approved. And so we wanted to say, hey, this is how insurance works. And patient advocacy is huge. There's pretty much an organization for almost every disease state out there. So I don't want to recreate a wheel for patients and give them one more place they have to look. We wanted to help patients kind of further upstream. So our entire here's how insurance works is geared towards the healthcare provider side. So yes, the physicians, but mostly those that work between the physician and the patient to try to speed that process up. Again, we're also working against the insurance company, but if you have some secrets and some loopholes, it definitely will speed it up.
Is insurance as complicated for all medication, or is it just when we get down to something like a biologic where it gets super complicated? So is it that you have to write a prior authorization for other medications, or is it really the more expensive and the more intense the therapy is, if I can use the word intense, the harder it's going to be? So like if I was just going to get a rescue inhaler, easy peasy. But if I was getting some sort of,
Nope.
nope, you
It's
guys are
actually
shaking your
not
heads.
true. Yeah, it's not true. And that's the sad part about it, because now insurance companies are putting a prior authorization process almost on every single medication. So nothing is easy to write, and everything involves 2 to 3 steps to get that medication into the patient's hands.
There's nothing worse than a 2-year-old with a peanut allergy, and I have to do a prior auth for an epinephrine injector. And I'm like, this patient clearly demonstrates that they have a life-threatening allergy, and you are going to make me spend an extra hour to prove it to you that they do. The parents need to go pick that up from the pharmacy and be done. And it's not just on like a device like that. There are inhalers, there are even oral medications that just going to your local retail, CVS, Walgreens, whatever pharmacy. And that's just from the insurance perspective. The whole next thing we can dive into is affording those different things, a life-saving device, or if you have blood pressure issues, being on blood pressure medicine. There's a whole nother layer to that of one, access to affordability. So short answer, yes, it's just as complicated.
Wow. And I wonder how many patients actually realize how much is going on behind the scenes to get them the medication that they want. Because I know that what I hear a lot from other patients is, oh, it's so frustrating. Everything takes so long. It takes so long for me to get to my doctor. Then it takes so long for me to get my medication. And sometimes I don't get my medication. And they get frustrated. And obviously the only person or people they see are their doctor or anyone else working in the office, and they blame the person they're talking to for the slowdown, for the roadblock. They don't think necessarily that it is the insurance company giving you the pushback. And I think that's what's so interesting about this series we're doing is like your insurance company is really the one that says no at the end of the day. You can do everything you can, but they have the power, and your doctor is trying as hard as they can because they want you on that medication. They're trying to get you on that medication. So I just want to reiterate that your doctor is on your team and you guys are working together to get the insurance company to give you the green light.
And my kind of controversial statement that I'm not afraid to make is that it really falls on us, the individuals that work between the provider and the patient. And so I try to spread the message, and really what NAMAPA is trying to do is equip those healthcare workers. It's our job to, when the patient's been prescribed a medication, to set those expectations. That is our opportunity to educate the patient on this process. And you don't have to go into what is medical versus pharmacy benefit, but getting the patient to understand that this isn't going to happen in 5 minutes. This could take 2 weeks to a month even. And it's not because we're not trying. We're here for you. But again, it's that insurance piece. It's making sure that we have that communication. So healthcare workers, we absolutely can do a better job of supporting our patients by educating them ahead of time. Address it up front. Be real with the patient, like, hey, this isn't easy. Reiterate that we're a team. And that goes a long way. That open, honest expectation setting. I think we as healthcare workers, and that's the controversial piece, we're all short of time, I know, but we could be better at setting that for the patients. And I really think that's the patient advocacy lens that we kind of need out there. So instead of complaining, let's create solutions, such as telling our patients, and then work from there.
Absolutely. And I think I've started doing that, just basically saying that the medication that we're trying to get, your insurance company may not like it. And so it may be harder to get it. And if I need more information from you, if they come back, then I might be messaging you. I might be asking for more information. So just make sure you get back to me as soon as you can. And then hopefully that'll make the process go smoother. I think setting those expectations up front is really helpful and important. And I think the patient then feels like they understand what the process is going to be like, and they don't just expect to pick it up that day, which I think if I was a patient too, without all the knowledge that I have, I would most probably expect that any medication that I'm prescribed, I should get within the next 24 to 48 hours. So I think it is really just important for us to let patients know that even the most simple medications can take time if their insurance company gives us a hard time. So I think that's really important, and I totally agree with that. I know that NAMAPA has created an awesome toolkit for physicians in their offices. Can you outline what that looks like and what that means?
Sure. So we have 10 modules, and it's really tough to cram as much knowledge and as much as we need to know down to 10 modules. So essentially the team from NAMAPA, who has various experience from various different specialty fields, again, the process is the process, came together, put this information in, and it essentially walks someone who's new to specialty meds from the beginning. What is insurance? What are different types of insurance? Through what does buy and bill mean? What does an override look like? How do you do a tier exception for affordability? So it gets more technical as you go through. And I think even for those that are really experienced, there's things that I've called it one word for my entire career, but the vernacular has changed. So it's really made to just kind of reinforce what the process is today. So whether you're brand new or you've got 20 years under your belt, there's something you can pick up from it and something that you can lean into to make your practice better. But the whole goal is that post-COVID, we've got, and I'm so tired of hearing it, I know everyone is too, but people changing jobs really quickly. So for a while, somebody works somewhere, then they hop to the next. Pay rates are changing. And so this is for the individual who maybe new into private practice, right? Maybe left the hospital, came over, or is getting their first job in healthcare. There are lots of little tidbits you can pick up in there.
So these videos are meant for the healthcare provider to watch or their entire team to watch. So like down to the medical assistant, to the nursing staff, to really anyone and everyone in the office should be watching these videos?
Yes. So we're really big on the team approach. And having been in private practice my entire career, it's the front desk answers that patient phone call. They may be taking the note that then goes back to the medical assistant. The medical assistant then has to talk to the provider. They may then have to call the pharmacy or the insurance. So it really is everyone in that setting. And especially in our smaller community-based or private practice offices, there may be only 2 people in there. So everybody's doing a little bit of everything. And then you tack on the more complex parts, right? Billing, copay assistance, trying to make sure that the provider can keep their lights on and salaries paid, and the patient doesn't have a huge outstanding balance. So there's something for everyone in there. And it definitely fosters that, hey, you've got to communicate, you've got to work as a team. And there's different modalities, right? If you're a video watcher, great. If you are auditory, it will read through for you. Or if you want to do it yourself, you can read. So there's different ways for individuals to absorb that information.
And each module is how long?
Each module will take you roughly, depending on how quick you are, and if you're just kind of refreshing skills, anywhere from 30 minutes to an hour. It's really not terribly long. It's meant to be bite-sized, but digestible enough that you get what you need to get from it.
Okay, so it's almost an hour, so 10 hours worth of content.
Correct.
Wow, that's amazing that you guys have put that together. And I love that you have it in both video format or just audio for people that want to listen and learn in different ways. So Elizabeth, can you give us a rundown of what these 10 modules look like? Because these 10 hours of content that you've put in, we can't summarize them in this 20-minute episode. But what we would like to do is give people an understanding of what you've put together and maybe some of the highlights of some of the things that you think, even if somebody doesn't have these 10 hours to listen to it, how can they go about kind of navigating the 10 modules and figuring out which ones they should listen to?
Yeah, so the titles of the modules are the buzzwords you're going to hear across the industry, right? So they are labeled according to what that spicy, interesting topic is. You know, the prior authorizations, government healthcare, billing and coding. So those are there, right? You can assume what's in that module based on those lovely titles. I mean, that's our vernacular. That's what we use. But what the module is kind of drilled down to, and everybody who's ever done a prior auth, anybody who's ever been in this side of healthcare, they always have that one story. I had this one time, this patient had this insurance, this is what happened. And so these modules kind of take that, here's my experience, and here's what you could have done with that. So not necessarily case by case basis where it picks it apart, but that's where we've really learned the most is I had this situation this one time, this obscure insurance policy, which made me do X, Y, and Z. And so we're uncovering those things in the modules that when you're going through and taking it, you may not see that every day, right? You know your normal payers, you know your medications you cover, and you know how to submit those. It's for those one-off weird things you don't see all the time that when you do, this whole series of modules will have given you the confidence and the ability to go into them and say, okay, I can handle this. And it'll also give you the, I think I've heard this once, so will this work for me? So it's giving you additional thought processes so that you'll be more efficient at what you're already doing. And there's little tidbits and tricks in there. If a portal doesn't work, make a phone call. I know it is tough to get on the phone, but that sometimes is the best way to submit something. Or if you're looking at billing and coding, how to check the EOB, how to check the claims form from a very high level, right? I don't need you to be a billing and coding expert, but I do need you to understand the very basics to save yourself a lot of time. So trying to expedite and save you some headache in there.
So if you're just coming out of fellowship, you've decided to start your own practice right off the bat, or you've worked for somebody for a couple of years and then you've decided to do your own practice. I think that we're taught so little about this process that I would say that some providers are going into this with almost zero knowledge. And so what I'm wondering is, if a provider maybe right off the bat doesn't have the 10 hours, are there certain parts of the module that you think they have to start with? Have you guys said, okay, if you've got 3 hours, you should listen to module 1, 5, and 7? Or is it kind of like you have to start with 1 and go all the way to 10? Or can you kind of do 1 and not the other and still feel like you're understanding what's being said?
Absolutely. The first chapter, the first module in there is the basics, the introduction to medication access and its terminology. So start there. Understand what these words are, because when your staff, especially from the provider perspective, when your staff comes to you and says, I can't get this prior auth because of X, Y, and Z, that can go over a lot of providers' heads who are new in that space. So start there, get the vernacular down, understand what those terms mean. And then the modules are escalating in levels of difficulty. And so if you are working as, the term we use is biologics coordinator, if you're working on specialty meds, or if you're the MA covering prior auth or whatever in the office, you should know all of those. But again, it's escalating. So from a provider perspective, start at the first one. And many of my providers don't work on medication copay assistance, but they certainly need to know the basics of insurance, the difference between government and private payer, all the way up through basic billing and coding, because you guys do code and you do bill. Once you get to that point, it's like, okay, I can stop here. But certainly if you want to expand your horizon and expand your knowledge, go all the way through.
It sounds like doctors need a whole new set of education. They become doctors, and then it's like, oh, and here's the whole admin side of being a doctor. And it sounds like you guys are filling that admin side that they obviously aren't teaching you in med school.
I'm very lucky to work with a physician who, they work with Campbell University. And so I do get to work with some medical students. Usually once a year, I go up and do a billing and coding intro for them. So if they're thinking private practice, they can understand the economics outside of the hospital. NAMAPA is one of our goals in the future, is to work closely with medical schools, residencies, and fellowship programs, because you're right. There is so much that's just kind of done. You're not taught, and you don't learn that till you've been in practice 1 year, 5 years, 10 years. So we would love to get out there and pass this info on to more.
And can you talk a little bit about the pharmaceutical companies and the resources that they provide? Because I think a lot of times people are worried about pharmaceutical companies and the negative of who they are, what they are, but I think that they actually provide a lot of good resources.
The pharmaceutical company, the manufacturers, I call them my best friend. And I know that a lot of people are like, oh, big pharma. When you are in an access role, those individuals, whether they're sales to get you more clinical information, whether they're reimbursement to get you different payer plans or what you can and can't do with their coding, there are so many different people within a pharmaceutical organization that absolutely all they want to do is help. And I know it gets overwhelming. They come by your office. I know some are super nice and bring you the best snacks and food and all of that kind of stuff. And, that kind of plays into the stigma of pharma. But at the end of the day, if I'm struggling with a patient, right? Who can speak HIPAA to me? So who can I talk to directly about that patient? Did I utilize all the resources that the pharmaceutical company has? And one that gets missed all the time is they have what's called hubs, right? So when your doctor prescribes you a medication, there's this long enrollment form to fill out and you send it to their hub. And the hub helps you by checking the patient's insurance, seeing if the drug is covered, and how and where you can submit that drug. I get it. We're checking that on our end too. But it's one more step, it's one more resource. So if I put everything through the manufacturer's hub, when I need help, they being the staff of the manufacturer, can help me. And there's nuances, right? Every manufacturer thinks their compliance is the strictest in the world, so they all have different rules. But at the end of the day, there are resources there to help. And so those same guides, those same cheat sheets, as I call them, go to the drug's website and you'll be able to find provider resources, patient resources, copay assistance forms. It's all there. There's this thing called compliance that people talk about, like it's the ugliest word in the room. And it's not. It's there to put guardrails and to help us. And so, again, I said in the very beginning, I have a problem with authority. I don't like being told no, but I do like guardrails and I do like having a set of rules to follow. So the compliance part of this and what you can and can't find and who you can and can't talk to really does further help you navigate the process. So be patient. Keep asking for the person you need. Again, their only goal is to help you get that patient on treatment.
So if I understand this correctly, if you're having a hard time with the insurance company, go to the manufacturer because they do have resources that will help you.
Yep. Most have like a prior authorization checklist. So for that drug specifically, what are common things that you need to have? Some manufacturers have programs that if the insurance is denying the medication for the patient, they have what are called bridge programs. So you can get the patient on therapy while you're trying to get the authorization approved. Again, we get so caught up sometimes just trying to get that authorization done. Like we just want the approval, just want that yes, that we forget that there are other forms of assistance to help the patients get on therapy sooner, because that's our real goal, right? Our real goal is to reduce time to treatment. But again, in that hustle and bustle, we've said it numerous times, your brain can only do so much at once.
Yeah, I think that for me, the take-home message is because I work with fellows, because I work at Mount Sinai, I also do work at Downstate with the fellows a little bit. And I think that for me, it's so imperative that organizations like yours get the funding that they need in order to make it to these fellowship programs and really be able to teach them. I guess right now that resource is available to fellows. They can also listen to it right now and take the time out to do that. And how can we make time, maybe even within their program, for them to do that and to have discussions with their preceptors on what does this mean? What does this look like? How can we learn? So I think that for me, that's one of the take homes, is that this education really needs to start earlier for physicians and healthcare providers in general, whether that's nurse practitioners, physicians, physician assistant, any of those professions that are dealing with this process. We really need to start with this education early on so that the process is made easier, because it's not going anywhere and it's actually just getting worse, as we mentioned.
And Quad AI has their practice management committee that has a meeting in the summer. And so we try to bring stuff like this to that, but not all the fellows get to go, right? That's mostly like, how do you run your business? So Quad AI is making an attempt at it. We've done a couple things with the college as well. So in the allergy space, it's great, but it's bigger than allergy too.
It's a whole learning curve that we need to get past for every single specialty. And that's why we wanted to start this conversation. I think this should be the start of the conversation. So Elizabeth, is there anything that you'd like to leave our listeners with?
You can go to our website, which is NAMAPA.org/training. And everything is there. You can go to just our website there, take a look around. But again, I love LinkedIn. So look me up on LinkedIn. Happy to connect. If you have healthcare workers or physicians that want to talk more about it, let's go. Let's get this moving, because that's what we need out there to really help our patients a little bit sooner.
What does that look like if a physician wants you to come into their office space and do an in-service, or if a fellowship program wants you to come in and do a 1-hour program?
Yes. So we have sponsorship dollars into the organization. So happy to come, happy to be there. Would love to do that. I say it's going to be longer than an hour, like give me 2, because questions take the longest, but we absolutely can do it.
And can that be virtual?
It can be virtual as well. Happy to do it either way. Send what information we have. Let's open up some dialogue. Absolutely.
Great. Thank you so much. I learned so much today. Thank you for everything that you're doing and all the work that you've done on this organization.
Thank you so much for having me.
Thank you.
Thank you for listening to today's episode. Remember that all information you hear today is for informational purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. And also, don't forget to subscribe to our podcast. And if you have a second, help spread the word by rating our podcast and sharing with your friends and family who might also be interested in learning more about allergies, asthma, and immunology. You can always stay up to date by checking out our Instagram, The Itch Podcast, where you can leave questions you are itching to know, or check out our website, which is www.itchpodcast.com, which contains more information about the subjects we covered in today's episode and every episode. Until next time, have a fabulous week.